Matthew Holt. Now I'm meeting Julie Yu. Julie is the, you're the Chief Product Officer, the co-founder and the general boss, as far as I can tell, of that Garda chap at Kyruus. This is Kyruus. Kyruus is a relatively new company compared to some of the one on the HIMSS floor, and it's in this really interesting area of referral and provider matching and skills. So, Julie, I suspect many people watching this haven't got a clue that there is a problem here. So tell us first off, what is the problem that you guys fix, and then we'll talk about how you fix it.
Absolutely. So we solve what we call the patient access paradox, where you and I as patients are told to wait weeks, if not months, to get an appointment with the doctor. And we think that that's because every doctor is booked out solid. That is absolutely not the case. It turns out that there is quite a bit of underutilized capacity that sits in all of these health systems that we work with. And our solution is designed to fix that match, the matching of supply and demand, such that appointment wait times go down for the patient and that capacity utilization goes up for the provider.
Okay, that makes it sound pretty simple, but I get there's a bunch of complexity about that.
Absolutely.
What do you need to gather data on, and what are the pieces that you have to put in place to build a solution for that?
Absolutely. A big part of our system is our provider data management platform, and our mantra is your ability to book an appointment with a doctor is only as good as your ability to find the right doctor. And so we amass literally billions of data points about physicians on the back end. We take data about the demographics of providers. We're tapping into multiple different internal systems of our clients to pull that information out. We also tap into the appointment booking systems to ensure that we have visibility into all of the available slots that a given provider has. Typically our clients have multiple scheduling systems in place, and so we are tapping into multiple systems and bringing that data together. We also provide, and this is probably the most important part, a clinical library that helps guide clinically the right match for between a patient and a provider. What it does is it translates the expression of a clinical need from either a consumer term or even a diagnosis that your referring provider submits into who are the most appropriate providers based on their scopes of practice. And so that's a big part of the implementation of our system, is really mapping out all of the diagnoses, the procedures, the symptoms that ultimately should be triaged to a given provider.
So if you have the right patient to the right provider based on availability and also with clinical information and the right skills, either within a system or elsewhere, what's the actual user experience? Are you just an analytics company, or do you actually provide stuff to front-end schedulers and patients?
We have 3 front ends and that are designed for 3 different end users. One, we have a call center solution that is used by schedulers who are sitting on the other end of the 800 number that's typically listed on the hospital website, and so that the vast majority of our customers are using that in their centralized call center type settings. We also have a provider-facing solution that helps your primary care doctor or your referring provider identify the right in-network resource for you as a patient. So we have that piece as well. And then the third piece is a consumer-facing solution. We actually have an online find a doc and scheduling application that can be white-labeled and essentially embedded into our clients' websites and mobile applications.
Right. So I want to go to 2 places now. Eventually I want to get to the bit about the company, but there's been a lot of fuss just recently about the inadequacy of provider directories, especially for health plans. Where are we? I mean, and I've looked at this a little bit in my career, back in the days I was a grunge consultant looking at trying to figure out which doctor was where. It's a really, really thorny problem that you and a few other people are attacking. Where's the state of play in kind of the understanding overall of where we are in terms of getting the right provider information into the hands of consumers and other providers?
Absolutely. So we strategically decided as a company to focus on large health systems as our client for exactly that reason, that we felt the source of truth really lives within the health system, the provider organizations. And so we come at the data problem, I would say, in 3 different ways. One is that we recognize that oftentimes the right information exists, but it might be sitting across multiple siloed databases. And so one of the major things that we're doing is bringing that data together and reconciling it. A lot of our back-end technology has to do with entity resolution. So how do I know that G. Gardner sitting in this database is the same as the Graham Gardner, who's a cardiologist, sitting in this database, versus the Gordon Gardner, who's the gastroenterologist, sitting in this other database. So all of the machine learning on the back end is really around how do you match and merge those profiles reliably. We also, however, recognize that there typically needs to be a human in the loop, so to speak. And so our tools are designed to apply as much automation as possible to that reconciliation process, but then kick out any exceptions to those rules. So if at the end of the day a human, a provider or a practice administrator needs to manually look at something and reconcile it, they can do that within our tools, and that information gets passed back into the system. So it's a constantly learning system that will update the rules as we go. So we recognize that really requires tight integration with the provider organization. I think some of why the payers struggle with this is that they're sort of one derivative removed from the source of truth. So we've really focused on getting to the core of the problem.
Do you think that on that payer end that there are some solutions, from folks like Better Doctor have been building some systems aimed at payers. Do you think that's going to improve, or do you think this only gets fixed at the provider end?
Yeah, one of the ways by which we're actually partnering with the payer world is to be a source of data that gets syndicated out to those payers. And so we do believe that it will ultimately require a tight partnership of the two sides. We see a lot of the technology that are being applied to the payer side really as empty vessels that rely on the right information to be submitted. We think that we can be a source of some of that data.
So you think fundamentally that you're going to be a data creation source as well as a sort of an application?
Yeah, we do anticipate that whereas our core business model today is licensing software and providing that front end, that there's a huge opportunity around the syndication of the data as well.
So we're kind of getting to where I was going, but tell me a bit about sort of the where you guys are with provider systems. You work with a lot of different provider systems. How integrated, how deep are those relationships, and give me a sense of where you are as a company on the sales side.
Absolutely. So we now work with about 25 large health systems across the country. We think about our book of business in terms of number of providers under management. So we're currently working with about 65,000 providers. And we specifically say providers because it's not just physicians. We also work with nurse practitioners, other advanced practitioners, etc. We have about 50 different types of providers that we manage on the system today. And we are extremely deep on all those that group of 65,000 providers in terms of both the data itself. So we have full profiles on all of those physicians and providers, as well as integration into scheduling workflows. So those are kind of the two angles that we think about as we go physician organization to physician organization.
And when one of those organizations signs up with you and it's all working well, what's the kind of lift they get in or how you define it? Right patient to the right doctor, or more patients filling more spots? How do you
we think about three categories of benefit. One is financial. A lot of the reason why people invest in our solution is the financial ROI associated with better utilization of provider schedules. So we think a lot about leakage reduction. How do you keep the referrals in network? But then how do you also improve the productivity of individual providers? So that's one of the measures that we've seen a huge improvement on, 50% leakage reduction for some of our clients. We think about operational efficiency. So in particular, I would say in the call center setting, we're able to make each individual call center agent far more productive. For instance, in one case, they had call center agents only able to serve 2 departments because of all the complexities of having to train up on, oncology versus dermatology versus cardiology. Our system has allowed them to scale to the point where those agents can now manage upwards of 20 different departments. So there's a huge operational lift there. And then I would say more on the qualitative side, patient experience. Many of our clients, pretty much all of our clients at this point, are thinking about how do I treat my patients like true customers and really enable them to have a reason to stick with us, to be loyal to our system. And so we think a lot about the patient experience metrics associated with our solution as well.
Great. Finally, talk a bit about the company. I know you and Graham Gardner started it. I'm trying to think. Tell me how many years
2011.
ago.
2011.
So 11, 12. Yeah. So actually, it's going on a bit now, right?
Yes.
You should retire by now, but not quite. It's a thorny problem, as we discussed. But tell me about that. You guys started it, and then can we give a sense about the growth of the company?
Absolutely, yeah. So I would say this particular market segment has really picked up in the last 2 years. We were slightly early to market, probably when we first launched. We're very fortunate to partner with some very innovative, pioneering organizations to get the system up and running.
Who are some early customers who helped you a lot?
So Providence Health and Services, which is now Providence St. Joe's, right, was one of our early access customers who is now a huge strategic partner. They invested in the company subsequently as well. So there's been a tremendous amount of growth with them. Similarly, that trajectory, as I said, over the last couple of years has really grown, and our company has grown commensurate with that. So we're currently about 100 folks, largely based out of Boston, but we now have offices in 5 different cities around the country to support our customer base, and we're venture backed and have...
How much have you raised?
We raised about 50 million, and recently, yesterday or 2 days ago, we just announced a strategic partnership from another one of our clients, Mercy Health, in Cincinnati, Ohio. So similar to the Providence story, we've been able to really grow our engagement with them, and we're very fortunate to have them as a strategic partner as well.
Fantastic. I've been speaking to Julie Yu. She is the Chief Product Officer, co-founder of Kyruus, which is a really interesting and very fast-growing, as you heard, company in the provider matching, referral, and data integration around provider space, which is a massive and complex problem that's bedeviled US healthcare, and people like Julie helping to fix it. So Julie, thanks for your time.
Thank you, Matt.